I chose the Lakewood Ranch Medical Center because my brother went and he had had just a wonderful experience. The first surgery went well, but the second one was so much better. Less pain, less nausea, and right there, that got me.
One of the reasons why Toni did so well after her second surgery was a new drug that we have available. This is a medication called liposomal bupivacaine. This is a local anesthetic that actually lasts 3 or 4 days. It's administered by myself during surgery, and it's made up of tiny vesicles or bubbles that have the medication inside of it. These bubbles burst at different time frames and provide a local anesthetic effect. So instead of it wearing off in an hour, patients have relief for up to 3 or 4 days. That allows them to get up earlier, they get to use less narcotics, and ultimately they usually leave the hospital a bit faster and are much more satisfied with their surgery.
Dr. Cashen was just extremely informative, and also the therapists were just so helpful.
One of the reasons why Toni did so well is she was able to get up the day of surgery. This allows patients to get over that anxiety of how much is it going to hurt when I first get up? Am I going to be able to do it? Will I be safe when I go home? And if patients do it the day of surgery, that's a huge boost of confidence for them. The next day, they're not fearful for going down to physical therapy. They're very excited actually now to be active participants in the rehabilitation.
For more information on the Orthopedic Spine and Joint Center at Lakewood Ranch Medical Center, call 941-782-2663.